Hello, Dr. Walter Lemo, naturopathic physician who has a practice solely focused in cancer care for over 20 years, my whole career. So I want to talk about the subject of proton pump inhibitors, PPIs, in oncology and cancer. So for those who don't know, PPIs are they're stomach acid reducing medications. So for patients with like reflux, with GERD, so you have like Nexium, omeprazole, pantoprazole. So all these medications that end in the prazole are known as PPIs. But what's happening in oncology is that there's this growing investigation and trend. Can they potentially cause harm and hindering the efficacy or the effectiveness of treatment? So there's research now being discussed with immunotherapy medications, so the checkpoint inhibitors like Keytruda, Optivo as examples, where there could be worse outcomes when people are on these medications, and some are suggesting even some worse gastrointestinal side effects. And then related to chemotherapy medications, for example, like one of these oral classes called Xeloda or capecitabine and oral chemo medications, there's actually papers to suggest that it could be worse outcomes as well, worse survival with these medications. And so part of it, where all the direction seems to be heading towards, is that are they altering the microbiome, and having some immune system effect that's making these medications not work as well. So in my experience, what I've learned is that whenever people are talking about interactions and negative interactions with, say, chemotherapy and other drugs, I find, and there's always this emphasis towards natural medicines, like, oh, you got to watch those. In my experience, it's been more the medications, the over-the-counter drugs that are more problematic potentially than the natural. That's been my experience, just looking at them both objectively. So anyways, so this is something that the general public doesn't really know. And I definitely, in my practice, see patients who are on these medications. I understand they are very effective at reducing acid and improving quality of life. So if somebody has, like, esophageal gastric cancer, they're really more potent and they can calm things down. But at the same time, should we be considering maybe alternatives? Like, there's talk about the older ones, the H2 blockers like famotidine or Pepsid. How about basic antacids? How about other modalities to work on, to see if there's other ways to calm down the acid, improve quality of life? You never really see that type of investigation to try to improve and switch over patients to other ones that there's less questions on. So I think this is an area that's important. Like these, some, like, say, the immunotherapy medications, like here in Canada, like one shot costs like $10,000, and people are on them, say, every month for like a year or years. And so, or, you have someone on capecitabine or Xeloda, and then potentially these could be hindering for them to work optimally. I have seen like a few cases. There's other classes called TKIs where they were going to be pulled off a medication because it appeared to be not working, and then I kind of noticed that a PPI was prescribed. Their oncology team didn't catch it, and I did. And then I said, hey, before any switches are made, maybe just get off that PPI, try something else. And sure enough, it coincided with the medication starting to work again. So this is a real big area. It's a complex area, obviously, in trying to manage patients. What do you do? How do you manage them? What other options to try? It takes work. But I think, when you're dealing with responses to medications, when you're dealing with like survival outcomes, when you're dealing with like, hey, you want the best mileage possible with medications, especially if you have an advanced disease and the toolbox of options they have is smaller. So it's something that I find is not being discussed by the standard of care conventionally, and it's something that we always keep an eye on with all our patients. And obviously you have to customize these with every individual case. But just so you know, that proton pump inhibitors with immunotherapy medications and with certain chemotherapeutic agents, there's some questions and there's some cautions there. Yes, more research is needed, more prospective research is needed, but nonetheless, the data that's being presented and being published is becoming more and more every day.